question today is for the Minister of Health. Does this sound familiar? Hospital loses faith in Ornge. Well, it should sound familiar because it's a Windsor Star headline to an article where Windsor Regional Hospital CEO says, and I quote, "Things have not changed at Ornge. Whatever cultural issues are going on at that organization, things have not changed." Terrible. Speaker, the minister has stood in her place saying she has fixed the problems at Ornge. But it's undeniable. The minister and the McGuinty government has failed. But they no longer need to take our word for it. The question is, will they now take the word of a hospital CEO right in the backyard of Dwight Duncan?
A reminder for the member, we refer to all members their riding or their title. Thank you. Minister.
Speaker, if the member opposite is genuine in his wish to improve care at Ornge, he would stop blocking Bill 50 and get that legislation passed. I do not understand, Speaker, why the party opposite continues to raise concerns but refuses to be part of the solution. We are making important progress at Ornge. There is no question about that, Speaker, but we do need to get Bill 50 passed and to ensure that there is oversight by legislation of Ornge, Speaker. As I say, it is unconscionable, frankly, Speaker, that they can complain, but they refuse to be part of the solution. In fact, they block the solution.
Hear, hear.
Supplementary.
Speaker, I honestly don't know how this minister sleeps at night. Again to the minister. We now know of yet another situation under your so-called new leadership. In April, Ornge dispatched a crew to Windsor Regional Hospital for a critical patient, but didn't send enough paramedics. Disgusted and frantic at the incompetence, the CEO of the hospital paid $500 cash out of his own pocket to pay for a taxi to send a nurse along with the air ambulance to fill in for the lack of paramedics. Is this her idea of cleaning up the mess at Ornge? The Windsor Star now says the Ornge ambulance crisis has become a full-blown scandal, and the Liberal government can no longer deny it. Minister, with a full-blown scandal under your leadership, why don't you do us all a favour, including Dwight Duncan, and resign immediately?
Be seated, please. Be seated, please. The first time was a warning. The second time was defiance. Minister.
Speaker, there is significant improvement happening at Ornge. Are we all the way there yet, Speaker? No, we are not. But we've added significantly to the strength of the Ornge team by adding...
The member from Renfrew has warned. Stop the clock. I also have another point to make. I find it interesting that more and more members are taking to using their earpieces to hear. That is not a good sign. And I don't need any other comment when I'm standing. Please finish, Minister.
Speaker, yes, we've got very good news at Ornge. I know that good news at Ornge is bad news for the opposition, but it's good news for the people of Ontario. We've got 10 more paramedics working. We've got more pilots working, Speaker. We've got new senior management on board. We know the member opposite is opposed to the the Southwestern Economic Development Fund, Speaker. He's voted against that. Is he also opposed to Bill 50? And I'm going to ask him, if you really want to be part of the solution, let's work together. Why don't you take on the job in your caucus of getting your caucus supporting Bill 50?
Thank you. Question.